Brown from KNS Chiropractic. 2 offices located outside the Baltimore area, one in Eldersburg, Maryland, and one in Owings Mills, Maryland. Today we're in our Eldersburg office, and I have Michael with me. Michael.
Yes, sir.
Michael doesn't want to be on camera, so that's fine, but hopefully you'll be able to hear him. Michael, tell him what's going on.
I've had multiple surgical procedures on my back and my neck trying to relieve some severe discomfort and pain. Haven't had any kind of relief yet until I showed up here. I've been coming in for several weeks. I had some adjustments and some dry needling done, and it's getting better.
Okay, so he's had a bunch of stuff done. Like, what exactly surgery had done? You had the rhizotomy, the ablation therapy where they burn the nerves
Yes.
in the back of the neck. Did you get any relief from that?
No, nothing yet.
What about did you go to physical therapy?
I tried physical therapy for a couple of weeks, and it actually made it worse.
Okay, so you're here. He's been in here for the last few weeks. So look, we got his MRI. He was sent over by his pain management doctor and the neurology doctor, and they diagnosed him with cervical spondylosis, some facet arthritis, cervical disc herniations, myofascial pain syndrome, foraminal stenosis, and spinal stenosis. Instructions were, hey, go see Dr. Brown, KNS Chiropractic, and do whatever I do, as well as he put in here dry needling for the tough trigger points that he indicated. So this is his MRI. Just give you a kind of brief little history. He has disc herniations at 3 levels, or disc bulges. First one's at C3, C4, moderate to narrowing of the spinal canal, diffuse disc bulge. C4, C5 also has a disc bulge, diffuse disc bulge, and C5, C6, he has a disc bulge with the disc material extending over to the left side, which is narrowing the foramina, causing pain that radiates down. So we started doing, we were doing some adjustments to him, and that's what I'm going to show you today. We're going to adjust his mid-back, upper back, where his neck and his upper back meet, and then we're going to dry needle this area. First, I'm going to actually dry needle it. The reason that we're going to dry needle him first is we want everything to be loose. The looser the tissues are, the easier the adjustment's going to be, the better the vertebrae are going to hold in place. So what we're going to do is we're going to dry needle these muscles in the neck. I've already marked him along the trap muscles and along the rhomboid muscles. These are areas that we marked that we found were tender. These are areas of trigger points of areas of spasm and inflammation and irritation that form within the muscle. When we put the needles in, that'll help to disrupt that pattern, should relax everything and make him feel better. Michael, how much better are you, percentage-wise, would you think, since when you first started a few weeks ago?
At least 70%.
So that's good. You're talking about somebody that was not getting any relief, and now is feeling a lot better. So
I have a lot more mobility now in my turning my head to the left, which I had none before.
Great. Here, show them this real quick, these muscles here. This is what we're going to be dry needling. And what happens is, and you can see, and this is a great picture, the way the muscle fibers, so this is the back of the neck, this is the shoulder, upper back, the muscle fibers are going in this direction. When they contract and they get tight, and that's what's going on, what they do is they squeeze everything together, they pinch it, they shift the vertebrae out of place, they compress everything down, pinch the nerves, and that's why you get that pain that radiates down the arm, along with his disc bulges. So let's get him started. Let's dry needle this. We've already prepared him. Actually, we already wiped him down with alcohol, and now let's dry needle him. We're going to be using some 1.5 inch. 1.5 and 2 inch needles on him. So we're going to get these muscles down along this rhomboid area first. And doesn't hurt or anything, does it, Mike?
No.
Okay. So like I told you before, when we get into this area here in that mid-back, what we'll do is we'll find these trigger points, make sure we're kind of on top of the rib a little bit, and we go parallel because we do not want to go down too far. That's why we lift this up. We lift this up to pull the muscle up. We don't want to go too deep in this area because his lungs are there. So we try to stay away from that. And these are areas where we're pretty tender on him. So this is getting into these trigger points. This is how breaking that up. And that's gonna really make him feel a lot better. And it'll also really help with the adjustments. Sometimes, and this is why his doctor recommended that he get the dry needling, because these trigger points are so tight and they're so deep in that area. And a lot of times when you have these very, very deep trigger points, it's very hard for your body to relax those muscles. So if we do an adjustment and somebody has all this tension and tightness in that area, the adjustment sometimes doesn't hold the way that we want. So if we can loosen this up and break up these trigger points, it'll help the adjustments hold in their position because everything will be relaxed. And we can go straight down here because we're about a finger's width away, which is just going right into these posterior, lower cervical, upper thoracic muscles. So we don't really have to worry about the lungs as long as we're next to the spine here. We got one right there. Doesn't hurt, does it?
Not at all. Some you can't even feel.
That's great. So look, I'm sure there's a lot of people out there that have tried a lot of different things, but if you're not getting the relief that you're looking for, ask your chiropractor or whatever if he does dry needling. If not, come and see us. We get very good results. We're located just outside of Baltimore. This is just in that posterior cervical area. These muscles here go up into the neck and they start in this area like I showed you in that picture. I'm gonna get this part right in here. Sometimes a little tender in this cervical area. You don't get headaches, do you?
No.
Good. Little tight in there. I mean, I definitely feel it when it goes into a tight trigger point. I'm gonna do one more thing. I wanted to get, he had a big trigger point in his trap muscle, so we're gonna do that here. Same thing in case any doctors are watching. When you grab this trap muscle, you definitely wanna take it, pinch it, and pull it out a little bit because the apex of the lung runs right under here. So we don't wanna go too deep. So take it, pinch it, pull it away, and put the needle in. All right, we're gonna leave him on here for about 10 or 15 minutes, and I'll be back and I'll show you how we're gonna adjust his neck, mid-back, and neck, mid-back, and upper back. Thanks. All right, welcome back. We just took the needles out of Michael. Now what I'm gonna do is I'm gonna adjust his mid-back, his upper back, and his neck. So we had the needles in there, helps to relax the tissues. Hopefully the adjustments will be a little bit easier. The vertebral holding position better because the muscles aren't pulling on them like they were. Deep, deep, deep trigger points. Attach into the muscles, attach to the vertebra, shift everything out of place. This should help to relax it. So we're going to adjust them in here and through this area. Now, the adjustment's super important. The adjustment's important because you're going to get mobility into the joints. The more motion that you have in the joints, the less these discs have to stay compressed and irritated. So we are going to adjust it right now. Drop yours off the table, Michael. Okay, we're right around this T4 area. And then we'll adjust in through here. Okay, take a deep breath in. Blow it all the way out. Wow, that was good. That moved great. That was a great release. This is where the muscles start, so we want to relax that. Now where I'm going to adjust him is not so much in this upper cervical area, more down in this C7, T1 area. This is where the neck and the upper back meet. This is where his C5, C6, this is where that main disc bulge was. So we're going to adjust this, and I'm going to use an adjustment with him on his stomach because I can get into this area a little bit easier. Tender there?
Yes.
And the joint's tight, it's fixated, so that's what we want to fix right here. Okay, just relax your neck. One more time, just drop it down. Wow, that was good. Good adjustment on that side. That feel good?
Mm-hmm.
And let's get on this side here. Great. So that moved really good. What we're going to do to him now is we're going to put him on some traction to help open up those joints, get the pressure off of the back of that disc. Thanks for joining. I really appreciate everybody watching. Please sign up for my YouTube channel, click the subscribe button, and look, if you're suffering with neck pain that's not going away, mid-back pain, upper back pain, whatever, please give us a call. We're located in Baltimore, 2 areas that should be very convenient for people in Maryland. Thank you. See you next time.